Hi, I'm Amber Clevenger. I'm here with Nick Mercadante, our CEO and founder, to talk about value-based care. Can you shed some light on it? First of all, what does it mean?
The insurance industry, which really they're the driver for the definition of value-based care right now, the insurance industry wants to get away from just paying a fee for a service. I see you, I bill a fee. I send you to surgery, I bill that, right? And move towards, I see you, I diagnose your healthcare issue. I try to find the best, highest quality, and ideally most cost-efficient way to treat you. And then the insurance company pays me for that. They pay for that high-quality performance.
So it sounds like a win-win situation.
In theory, it can be a win-win. The patient spends less money, they get to better health, the provider is adequately reimbursed for their efforts at providing high-quality care. And I think that that's
the goal.
That's the
goal.
Dream. That's the dream, right. Now ask me if that's what's actually happening.
What's actually happening?
So what's actually happening is a wide range of outcomes that are not really showing that value-based care is being applied consistently and effectively for that purpose. And to just name a few issues that are occurring. One is, at the onset of a value-based care arrangement, there's some question around the motivations of why certain things are being reimbursed and why other things are not, right? And that, I think, is an issue of who's making those decisions. Right now, it's health plans and in some cases the federal government, right? So there's that issue that's kind of this issue of downstream. Are we actually making people better through value-based arrangements? I think the second big issue is adoption, right? We are asking a lot of healthcare providers, especially independent providers, to adopt value-based programs, true value-based programs. They have to be very sophisticated when it comes to managing their data and measuring what they're doing to know that they can meet those benchmarks, right? They're being asked a lot financially upfront to take on risk that you might not get paid. If you're not perfect to this contract, you do it how we said you should do it, you may not get paid. And that's scary.
So there's risk.
There's real risk, right? And then, I go back to who's making that decision, that there's an amount of distrust or not making the healthcare provider and the patient the ones that are really in control of the paradigm of what is considered quality or value for that individual patient. And that leads to bizarre things. I think all of it leads to bizarre things. We have some provider groups that are trying to meet their value-based care contract, and in the process, they're keeping certain patients out. There's this issue of that the patient is not a stakeholder in it. The patient doesn't know, why are you doing a certain treatment or not another treatment? They're not a stakeholder in the value-based paradigm.
So what's the solution?
I think the solution is to put more control and decision-making authority over how we define value-based care and how we arrange those contracts into the hands of the providers and the patients. Providers are pretty good at self-governing, right? They have associations that look out for each other, peers. They're all subject matter experts that want to do what's best for their industry to promote high-quality care, to follow the science, to create trust with patients. And there's mechanisms for that already exist that we can adopt to then dictate and define what those contracts are and how we get paid. And then I think it's also involving the patient. Again, there are mechanisms for informed consent with patients. Tell the patient, talk them through it, have them help make that decision, and then actually compensate for doing that activity of informing a patient on best practices based on what your profession and the science says.
Do you see that as an actual possibility? Do you see, if this is the solution, do you see it happening soon?
It's absolutely a possibility. I don't know if I see it happening soon because I keep going back to who holds the keys, right? Who's the key decision maker? As long as health plans are the sole arbiter of what is value, I think there's always a question of motivation. Is it their quarterly profit and loss statements, or is it truly what's in the best interest of patients and providers? And I think until we put some controls around that and force the hand of health plans to put some of the control back in the hands of the providers and patients, we're going to have trouble coming out.
Thank you so much.